dellu si waat indi leen xéewal bu neex a neex fii ba weeri octobre di jeex waaw fii ba weeri octobre di jeex mën nga am sansu win benn saaku maalo saa yoo jotee xaalis fii ci biir réewi Gambia bàyyee ko foofu sa UK Europe US Canada ak Switzerland ak Supersonics Money Transfer xanaa lii neexati na doore ko tey ba weeri octobre di jeex mën nga win benn saaku maalo saa yoo jotee xaalis fii ci biir réewi Gambia bàyyee ko UK Europe US Canada ak Switzerland téeméeri saaku maalo ñoo fi nekk kon gaawal nga bokka ci téeméeri nit yi nga xam ne mën nga am sans win ci xéewal yi nga xam ne kenn dootu ko natable ak Supersonics Money Transfer bànneexu leen ci suñ yónneekaay xaalis bi gën a wóor gën a gaaw gën a noppale ak yónneekaay xaalis bi gën a màgg ci biir réewi Gambia te duñ la fayeeku dara saytu leen ñu ci Google Play Store wala Apple Store nga mën a bindoo ci suñ app bi di Supersonics Money Transfer app shuu cay bii xéewal ak Supersonics rek
You want to know about the Gambia entertainment industry. You want to know the existing policies and programs of the arts and culture sector. You want to know about the governance and management of the arts associations. The program will throw a fresh light on the entertainment industry in focus. We will touch so many angles about the cultural sector, the opportunities and challenges, and interrogate them, and most importantly, offer solutions.
Hey, Allah bol onko ko dunia be entala kan raymol cutting hit traction bondinke sakin daga grino ma fonka. Hey, ngo njibe Gambian Talent TV la bata dunia beiti man nega ngo mafu ko Gambia da ma nega bari dunia yow man al mube ba Gambian Talent TV la jibe kan Allah bolom Mr Dunia be ya to yalla mi ade be kama no bandi yo.
Not only WHO, this is not only UNICEF, it's a joint coalition.
Positive cases of COVID in the country. More than 150 people have perished. So COVID is real. It is an imminent threat in the country to its social and economic development. The COVAX facility has been established with a number of international development partners, including the World Health Organization and the support of UNICEF, to facilitate the logistical movement, the transport and the delivery of the vaccines from international warehouses to the countries. Last Sunday, you all know that we already received more than 37,000 syringes, which were delivered here to the airport. And this is the first consignment of the vaccines, which came directly from India through the Serum Institute of India that has a licensing agreement to manufacture the AstraZeneca vaccines. The vaccines that have been received today are of the AstraZeneca kind. A total of 36,000 doses. There will be additional doses received over the next couple of months until the months of May or June. Today's ceremony is to guarantee the handing over, the official handing over to the Minister of Health, so that the Minister of Health can then implement and set the course to kick off. We would hope that this would be happening sometime next week, the official vaccination campaign against COVID and the priority groups that the Ministry of Health has already identified to receive the vaccine on a priority basis. The key information that we want to put out there for the Gambians to listen to and to be able to really absorb this information. The vaccine is secure. The vaccine helps to prevent COVID illness, and it also helps to curb transmission. And this is very important that you in the media transmit this information, because there's a lot of misinformation out there regarding the vaccine. So the key element, the vaccine is safe, The people who will be administering are professionally trained in the administration of the vaccine, and the people who receive the vaccine will be protected against COVID-19 illness.
So we understand, as per the interim distribution forecast, 180,000, AstraZeneca doses, were mentioned, to be delivered in the country. Today we have about 36,000. Has there been any update on that interim distribution forecast?
Yeah, the initial forecast to 180,000 is the total that was tentatively allocated to the country. But that's pending the availability of vaccines. For the current, supplies that is in the market, the countries were apportioned certain amount of that indicative figure that was indicated to the country because the vaccines that are produced are not enough. But we cannot wait also until we have enough supplies of vaccines. Whatever is available, this COVAX arrangement is actually, from the outset, was designed in such a way that when the vaccines are made available, we immediately dispatch whatever is available and start immunizing people so that we protect as many people as possible. Focusing primarily first with high-risk groups. These are health workers who are actually every day exposed to COVID infection because of the nature of their job. And the other group is people with comorbidities, which we call hypertension, diabetes, cancer, or chronic illnesses or obesities. There are many conditions. If they fall in that category, they are also among the priority groups. The other third age group is about age, those who are 65 years and above. So this is, I think, where the focus is, and these vaccines that we are receiving will be addressing those priority groups as much as possible, particularly starting from health workers. But since Honorable Minister is here, I think we'll continue also our conversation later on. Thank you.
Good evening to you all. I would say this is record in number. This is the first time I'm seeing this number of media houses on this at this port. Thank you very much for responding to our call. I know it's an important event. That's why we are all interested to be here. With us here, we have our Honorable Minister of Health, Dr. Ahmad Lamin Samate. We have our partners also, our country representatives for WHO, Dr. Desta. We also have the UNICEF country director, Mr. Luis. We have our national coordinator, Mr. Yaya Sanyang. Honorable Minister, Mr. Silla. He's the chair of the Select Committee on National Assembly member, the chair for the Select Committee on Health. Good evening to you all. We will have a short ceremony. We don't intend to make this thing long. The first thing we are going to do is we'll do a handing over because this consignment is being facilitated by UNICEF. So we'll do the delivery and hand over to government. It will be received by the Honorable Minister of Health, Dr. Samate. So we will allow them to do that maybe 1 minute or two. That may take about that. Then that will be followed by statement by both WHO and UNICEF. We will also have statement from the Honorable Minister Silla, National Assembly member, and the vote of thanks will be delivered by the National Coordinator, Yaya Sanya. So that's the program rundown. So now we will allow Mr. Jonathan Lewis to hand over the item to the Honorable Minister of Health.
Well, we'll do this symbolically, Honorable Minister, and it's a great pleasure to have you here at the moment. This is it's not really a symbolic handing over because of the fact that standing behind us, there are a total of 36,000 doses of the AstraZeneca COVID-19 vaccine. This is a vaccine that's been manufactured under license by the Serum Institute of India of immunization in the Gambia, because the Gambia has a tremendous and terrific track record in immunization, not only in West Africa, but known worldwide. So this is only one of several chapters that we're going to protect individuals. We remind you that COVID is still out there. We are now at approximately more than 4,700 cases, more than 150 deaths, and a lot of people believe that COVID is over, but it's not. And this is one indication that the government has taken seriously the fight against COVID, and that one day we will be able to say goodbye to COVID here in the Gambia with all of this assistance. So, Minister, congratulations, and we look forward to working with you.
Thank you very much. Thank you. Thank you. Good. Okay.
Maybe Dessa can say a few words on it. Yeah.
Okay, thank you very much. Let me also take this opportunity to introduce our permanent secretary, Mr. Muhammad Lamin Samate Jaite, and the Director of Health Services, Dr. Mustafa Bite. We also have some other directors in the name of Baba Ninsawal and others. So thank you very much. Now we will allow Mr. Desta Teruni to give his short statement.
Sorry, can I come?
Can we open up a little bit?
Jonathan, the UNICEF representative, Honorable Sila, member of the National Assembly, and the chair of the Health Select Committee, and the National COVID Response Coordinator. I'm very much delighted today, tonight, at this moment, at this time of the day, to be with you here. Very strange. We never do this because something important is happening. And after over 1 year fight with COVID-19, we are now seeing light at the end of the tunnel. And today we have witnessed the arrival of 36,000 doses of vaccines against COVID-19. And through the COVAX facility, which is actually a collaboration, as was already mentioned, between WHO, UNICEF, Gavi, and CEPI, which is and also there are many other partners that are also behind that are collaborating with these institutions. And we are in Africa, actually we are among the very few that were fortunate enough to the first batch of the vaccine. And we have heard about Ghana and Cote d'Ivoire recently. And today, Nigeria and DRC have been added also. And we are now together. So this is quite a fortunate event for us. As you know, COVAX is one of the three pillars of what was established as access to COVID-19 tools, accelerator. One wing is for treatment, the other wing is on diagnostics for COVID-19, and the third one is vaccine, which is also important. Initially, we thought vaccines would be very late. They will not come at this time, but we are quite fortunate to see that this is happening today in front of us. And in the COVAX aim is actually there are certain objectives that we want to achieve through this collaboration. One is to ensure that the vaccines are for the 20% of the population, which is estimated to be at higher risk because of the nature of the job or because of the nature of, some conditions, they are more exposed and they are likely to develop serious illness. Vaccines will be available at least for the 20%. The second one is accessing diverse portfolio of vaccines through this COVAX arrangement. It's not only one vaccine. In the COVAX for now, we have AstraZeneca, but tomorrow we are expecting, I think in few days or months' time, more and more vaccines to come in this basket. And then that will increase also the likelihood of getting this access to the vaccines. And vaccines are also at the same time delivered as soon as possible, as soon as they are available. This is a testimony. We don't have enough vaccine in the world, but whatever is available through COVID arrangement, we are able to deliver 36,000 for the Gambia, at least to reach to those that are at high risk. And the most important aim at the end of doing all this is to end the acute phase of the pandemic, meaning the burden on the health service, the burden on the whole system will be relieved. If we have less people who are getting severe disease, we don't have to admit many people in the whole facility. If we don't do that, we'll be able to take care of others with other conditions of essential health services. And that if we do that, we'll be able to rebuild the economy very quickly. So this is the objective of the COVAX arrangement, and that's why we are very happy today to see this happening. So together with our partners, the WHO and its partners, through the COVAX facility, is working to support the equitable distribution. That's the cornerstone of actually the COVAX arrangement. Equitable distribution. Irrespective of your capacity to pay for the vaccine, or you will get vaccines. Countries in Africa, they have not paid for the vaccine, but they have received the vaccine. This is actually the dream that has never happened in the world, and this is history. And it's very good public health achievement globally. And for the first allocation to arrive in the country, countries have to fulfill certain requirements. Gambia is among the ones that fulfill those requirements. And these requirements include like confirmation of national regulatory authorization, and for the vaccines to be delivered here, and indemnification agreement, the national vaccination plan, and as well as other logistics such as export and import permits. All this was done. That's why Gambia was actually eligible to get the first batch of the vaccines. So all this is because of the leadership of your Honorable Minister, Dr. Samate, for your leadership and your team, hard work. We are able to see this day. So congratulations for the good job that was done. And now the vaccines are here with us. So what we are actually urging people who are eligible for this vaccination. Not everybody will be able to receive this vaccine because we don't have enough. So there will be priority groups that will be prioritized by the Ministry of Health. These are health workers, those who are above 65 years of age, and those with pre-existing conditions, according to the ministry criteria, which is in line with what WHO has given as global guidance. So those who are fortunate to be in this group this time, please take this vaccine. This vaccine is effective and safe. And it has gone through a very rigorous process of review and verification, validation to make it available here. Any vaccine that comes through the COVAX facility has undergone through all these processes. Without that, it will not be even given to the countries. And apart from that, the Ministry of Health and the National Medicines Control Agency have reviewed the evidence. After careful review, they have endorsed this vaccine for use in the Gambia. So it's not just dropped to the Gambia. It's after all that rigorous process. So I'm appealing to those who are actually watching me, please, this is safe and efficacious effective vaccine, please take it. If you are able to receive it, you are lucky, and don't hesitate to take the vaccine. This is my message to all of you. And I'm confident that more doses of the vaccines will be arriving in the near future with the same COVAX arrangement. But be ready. When the vaccines are ready to be given to you, please don't hesitate. Jump on it and get the vaccines, and will save lives as a result of this collaboration. So even that, taking the vaccine is part of your commitment to contain the spread of this disease, which is really halting us from doing many, many things and hurting also our economies. And the other thing that I want to also pass as a message is this vaccine is a 2-dose vaccine. To be protected, you have to take 2 doses in an interval of 8 to 12 weeks. So therefore, if you take the first vaccine dose, please make sure that you receive the second dose within 8 to 12 weeks. That's how your protection will be guaranteed. Don't stop at the first vaccine. And don't listen to rumors. Don't listen to social media news. Get the information from the rightful place. The Ministry of Health will advise you. Ministry of Health is mandated to protect the health of the nation. So if you want the right information, please ask Ministry of Health. There are officials there that can explain to you and help you to understand. So there's nothing hidden behind this vaccine. It's meant to protect us and to protect the population. So with that, I think I would like to really thank the UNICEF for expeditious, for very quickly expediting the process of moving the vaccine to the country in a record time. And this is a partnership that we really appreciate. And we are ready, with Honorable Minister, with your guidance, to embark on the vaccination campaign as soon as possible. As partners, we are ready to really support you to make this happen as quickly as possible, so we don't waste time a single day for the vaccines to sit in the storage facility. We want them in the arms of every person who is eligible for the vaccine. I thank you very much for your.
Thank you very much, Dr. Well said, and I guess well done. And the number of people we have, the number of media houses we have, if this is well disseminated, I think it can reach to any part of this country. Having said that, we want to invite the Honorable Silla, the chair of the National Committee, Select Committee on Health, to make a statement. It will be followed by the National Coordinator, and finally, Honorable Minister will do the statement.
Stand for quite almost
You
1
also
hour.
be given the opportunity to interview the Honorable Minister after the statement.
Would you mind so that we can access him?
Yes, I want to express my delight to be witnessing this historic moment, that is the delivery of COVID-19 vaccines to the Gambia. In fact, I was invited by the Honorable Minister of Health through the Director of Health Services to come in my capacity as the chair of the Select Committee on Health, which performs oversight on the sector, because the committee has been concerned, and we expressed this concern to the minister regarding Gambia's access to the vaccine. We were promised, in fact informed and also promised, that Gambia is going to benefit from this basket facility, that is the Gavi, COVAX, which is an initiative of stakeholders, that is WHO, Gavi, and of course UNICEF facilitating it, that is pooling resources to acquire the vaccine for countries like the Gambia. So we were looking forward to this day. We really welcome the development, as this is coming to save lives. As a representative of the people, our principal duty is to be promoting lives, promoting the welfare of people. And as you know, COVID-19 is deadly. COVID-19 kills. COVID-19 has devastated the Gambia, not only lives, but you can see the economy, social relations, as in everywhere else. So it is our duty to support any effort, any initiative that is geared towards saving the lives of the dear lives of Gambians, because as you know, it has been mentioned that somewhere around the region of 150 lives have been lost, and these are precious lives. They could have stayed. They could have made a difference in terms of the challenges that we are confronting as a nation. So we would have needed the lives around, and this vaccine is coming to save lives. So what I'm saying now, and this is the appeal, it is our duty. It is the duty of the media not to allow your platforms to be used by social media that is discouraging people from taking the vaccine. We are urging you to join the fight, to join us in the fight to save lives. Don't allow your platforms to be used by conspiracy theorists. Encourage people to take the vaccine because it's coming to save their lives. Of course, we are told that this is not the first time. This consignment is not the first. We are expecting more from this COVAX facility. And we are even informed by the minister that there are other stakeholders, international, who are interested in supporting the Gambia. AU is one. And we are looking forward to that. And Gambia government too, at some point, we as a National Assembly are ready to look for the resources, however meager they may be, to ensure that Gambia accesses more of these vaccines to save the lives of our citizens, our fellow citizens, our fellow compatriots, lives that are dear, that should be preserved. So I don't have much to say, but only to thank the WHO, Gavi, and UNICEF for facilitating this, procuring the vaccines, and then making them accessible to the Gambia, and also the proactive Minister of Health and his team. He's very proactive. We have been working with him. He's not the first minister we've been working with, but we can attest to that fact that he has been very proactive. We are engaging them as an oversight to ensure that they deliver. And I can say that they are really up to the task. So that's why whenever they call us to come and give support outside of the National Assembly, we are happy to do so. We have a good working relationship with the WHO as well, and also UNICEF. So we are encouraging you to continue the support. We acknowledge the support on behalf of the people that we represent, the Gambian people. Thank you for the support that you're giving us. There's nothing more that we can say other than thank you. We really thank you. We appreciate you. We appreciate the gesture. It's a gesture of humanism, not humanitarian, but humanism, you know. So on that note, I once again want to thank everybody. The coordinator is here of COVID. It's unfortunate that we have not met yet. We have spoken on several occasions, and he's also really up to the task. We've seen that we are really encouraged with what they're doing. We really appreciate what they are doing. Of course, they need more support. There's more support that is needed in terms of addressing COVID at the level of the state, National Assembly, the executive, but the population, media, you too have a role. So I'm imploring you, the media, to rise up to the occasion, ensure that people are convinced, because COVID-19 is science. And the scientists, the scientists have spoken. They are telling us that the vaccine is safe, is efficacious, is effective. What more do we need? What else do we need? What more convincing do we need? For me, I am convinced, and I'm encouraging you to all of you to be convinced as well, and then transmit that to the entire population, not only those that are vulnerable, but the entire population. COVID, as has been stated by the UNICEF rep, is here. The WHO rep also said COVID is here, and it's here, it's still here. In fact, I even wonder this kind of arrangement, but I'm safe. In fact, if doctors can be mingling with us, I'm safe. But I also believe that the face mask, is also saving us, is helping us. So on that note, thank you very much. Thank you for the media. Thank you. We look forward to your support. Huh? Thank you. Thank you, Honorable Minister.
Thank you, Honorable Senator. Thank you very much.
That was very good.
Thank
you, sir.
for that
Hold on.
encouraging remark.
Minister, you should come here.
Yes. Thank you.
Now we will have Honorable Minister.
Sorry, you can't
Yeah.
get this one.
Well,
You have to help it. Okay.
It can be your way. Your accounts protocol.
I'll be on this side. To balance.
yeah.
Just click on. Slightly bend. You can.
Chairman of the occasion, we are very excited to be here. And I start by recognizing the passion of Honorable Silla. He's very passionate and he's very committed. We keep on saying this kind of relationship between the legislature and the executive is because we see things in a similar light, working together for the good of this country. That is why each time we have occasions like this, he's one of the first we invite because we know what he stands for. Honorable Silla, we thank you very much for that wonderful speech and for the passionate appeal to the people of this country. People listen to you and your colleagues, and I'm sure people will listen to the words you have said and the words of the WR and the UNICEF representative in this auspicious occasion. The chairman of the House Select Committee for Health, Honorable Silla, the UNICEF country representative, our brother, Mr. Luis here, the WHO country representative, our other brother, Dr. Tiruni, the COVID-19 coordinator, all the team members from the WHO and UNICEF, the ladies and gentlemen of the media who have always been around, come rain, come shine. We are together, we go to various places together. A lot of questions, sometimes stressful times together. The officials of the Ministry of Health, Permanent Secretary, and his team, the Director for Health Services, the Director for National Pharmaceutical Services, the EPI team, all other officials who are here present at this time of the day. We recognize your presence and we are delighted to have all of you here. The outbreak of the new COVID-19 disease in 2019 has brought unprecedented and a new wave of global public health challenges throughout the world, overwhelming health systems and disrupting all aspects of our lives and services. Addressing and combating this very serious pandemic requires a new way of thinking and approach. As we have seen from the beginning of the outbreak to now, that no individual government has all the means at its disposal to fight the pandemic single-handedly. Instead, the whole world embarked on an unprecedented search for a quick means of curbing the spreading and combating the disease. Accordingly, our ministry continues to deliver essential curative and preventive healthcare services through our various strategies. And equally, an additional burden of dealing with the COVID-19 pandemic. The establishment of the COVAX facility by the Global Alliance for Vaccine and Immunization, Gavi, the World Health Organization, and the Committee of Epidemic Preparedness Initiative to help mobilize and pool resources to enable lower and middle income countries have access to high quality vaccines was seen to be the only intervention that can bring the pandemic under control. The COVAX will provide vaccines for 20% of the population of the Gambia. The allocation will be able to vaccinate all those who are aged 40 years and above, including priority groups. This summing up to over 480,000 Gambians as projected in the 2013 census. The Gambia government, in collaboration with its traditional and development partners like WHO, UNICEF, the Gambia Red Cross Society, World Bank, the United Nations systems, who have all been there with us, UNICEF, again, WHO, World Food Program, UNDP, UNFPA, they've all been around enough to support the COVID-19 activities. The Diplomatic Corps, Africa CDC, the National Disaster Management Agency, the Gambia National Army, the Gambia Police Force had all come together in an unprecedented fashion to support the Gambia government in its drive to combat the disease in the country. The entire government machinery has been mobilized by the president to respond to COVID-19 pandemic and its ramifications. At this juncture, we would like to sincerely thank our frontline health workers who have been there throughout, risking their lives day and night under very difficult conditions to provide care for the sick without turning their back. They will never be forgotten. We will never forget their efforts during these trying times of our lives. At this point, we also remember the healthcare workers who lost their lives to COVID-19, and we extend our sincere condolences again to the families. A lot of Gambians had also lost loved ones to COVID-19, and this is an opportunity again to extend our sincere condolences to the families of all the lost ones. We remember all these people again and again, but more so today because they had not had the chance of being vaccinated. Probably if these vaccines were discovered then, they would still have been with us today. So I think this makes it a unique opportunity for those of us who are still alive. The EPI program, that's the Expanded Program on Immunization, maintains a good cold chain network countrywide. At national level, vaccines are stored in a walk-in cold room and walk-in freezer room before transported to the regions on a quarterly basis using a refrigerated truck. At this point again, we want to inform the people of this country that through our partnership with Gavi and UNICEF, we have these brand new facilities that have recently been built. We didn't know there was going to be any COVID-19, but in preparation to strengthen the country's health sector, these facilities are built and they've become very handy to deal with and manage these vaccines that are just arriving. The same mode of transport will be used for the COVID vaccines to ensure that the vaccine remains safe and potent for as long as its shelf life permits. We are gathered here to receive the first consignment of COVID-19 vaccines to mark what will be the beginning of an end of the pandemic throughout the globe, inshallah. It's therefore highly significant that all Gambians classified as high-risk groups, these are the healthcare workers of all categories in both public and private facilities, in the pharmacies as well, people living with chronic diseases such as diabetes, hypertension, cancer, among others, elderly men and women of 65 years and above, teachers, security forces. These will be especially vaccinated first in the next coming weeks. We should know that vaccination can bring the COVID-19 pandemic under control in the Gambia and throughout the world. Everybody, especially the print and electronic media, youth groups, traditional rulers, regional administrators, have a stake in this crusade. I want to take this opportunity to call on every Gambian, especially those regarded as high-risk groups, to help protect themselves, their families, and the entire population from this dangerous disease by making themselves available for vaccination. We must close our ears to those few elements amongst us spreading false information about COVID-19 vaccines and dissuading people from taking the vaccines. As the three speakers before me said, these vaccines are safe. They've gone through very, very rigorous processes before we receive them here, and we urge everybody who is eligible to participate in the vaccination process. We must not allow the disease to gain a foothold in our country now that the vaccines are available to protect us. We can save our country and our continent from being a reservoir of COVID-19. The Gambian population is known to be highly receptive to vaccination since the establishment of the National Immunization Program in May 1979. This is why we have reached the elimination stage and even eradication of some childhood killer diseases such as diphtheria, whooping cough, and most recently poliomyelitis, to mention a few. Hopefully, that will be the case for COVID-19 as well. The vaccine will be given free of charge to targets identified. As a nation, we are too small to allow the disease to gain a foothold in our country. We continue to work with our development partners to protect the population of our country. Our ministry will keep the population informed as at when the actual shot will be given. We are getting that together. We'll inform you as and when that will happen to ensure that now that we have the vaccines, they are given to the people who actually deserve them. At this juncture, certainly, I would like to again thank our brother here for all the hard work, the running around, the coordination Dr. Luis has done with the UNICEF team. We appreciate it, and we thank you sincerely from the bottoms of our hearts.
To the team. Yeah.
Now, to the WHO. We have been in it together from the beginning as well. We attend all these vaccine meetings, all these coordination meetings, sometimes till 8, 9 p.m. in our office. The last one was yesterday. We are all there till getting close to 9 p.m. This is how passionate Dr. Dexter is. So for him to drag the entire team out in here today, you can imagine the degree of commitment, just like UNICEF.
Bravo.
I think I want to tell the people of this country, we have very good partners. We have very good partners who are very supportive, who are always by our side. But I think they are also by our side because they've seen the commitment from the highest level, from the president himself down to all our workers in EPI, in the other facilities, at the health facilities, our nurses, our doctors, our pharmacists, our laboratory technicians, our cleaners, our security officials, and all the people, because it is teamwork. Every member of the team is very, very, very important. We all have a very important role to play in the success of the response. And I urge every one of us to continue, because it's not over yet. COVID-19 is very much around. As we speak to you, we continue to lose people to COVID-19. So we should maintain the social distancing, which increasingly becomes difficult, even at this venue. As we start socially distant, we gradually crowd together again. Of course, it is difficult, but we must ensure that we maintain social distancing. We put on the face mask, we continue the hand hygiene, and make sure that we continue the cleanliness that we all had adopted or increased at the beginning of the pandemic, because anything that kills people, I think, is very serious, and people continue to die of COVID-19. Yes, the vaccine, we want people to make themselves available, accept the vaccines so that we are protected. But of course, the arrival of the vaccines should also not mean that we should be complacent and we forget about every other preventive method. They go together. So it is the vaccines come to strengthen our response, our strategies. It's part and parcel of the preventive strategies. The vaccination is part and parcel of that. And so the day is fast spent. Otherwise, we could go on and on and on because of excitement. But we want to thank you very, very much. The men and women of the media, your role is very, very, very important in this. Because what people are going to hear is through you. What we would have said at this tarmac here, nobody would have known if you were not here. So you are the ones that get the information to the public. So let's all endeavor. We have a stake in this. And news can be reported in various ways. You know better than myself. It could be said in a way that makes it positive. And even the positive thing can be said in a negative way if you wish to. But we urge you all, it's a national responsibility to continue the good work that you are doing. And let's encourage our people so that we collectively win this war, or these efforts. These are efforts. I call it efforts against COVID-19. And we want to acknowledge all of you. We started it together. Inshallah, we'll end the COVID-19 things together. We thank you all. Once again, thank you.
Acknowledgement to the Minister, Minister of Health, the UNICEF rep, the WHO rep, permanent secretaries, directors of services, the teams that are all here. The Minister has said thanks to most of the people that he's outlined. So I will not repeat that again. I don't think that's going to be fair. But there are a few things I want to mention who probably most of you wouldn't know had participated. And that's because I was a vaccine officer myself. There are hundreds of people behind this vaccine to get it here. But I will not come to that first. I'll first of all start with the Cabinet Subcommittee on COVID, which was established by the President. That has provided the leadership, the sense of direction to get us to where we are today. And that committee is still the one that is leading the government direction and policy in terms of COVID response. So we pay homage and we pay thanks to them, and even in their absence, for all the hard work that has been done over the last 12 months. And we hope you can continue to do that again. The other group of people I want to say thanks to the Honorable Minister and his team. It has been a long period to get these vaccines. I don't know how many times Dr. Bite, myself and Dr. Bite had to be running around different ministries to get all the papers dotted and signed and all the things done. That takes a lot of commitment and effort. And Honorable Minister, we want to say thank you in front of everybody. Most people here wouldn't know how long it takes for us to sign all these dotted lines to get this far on the vaccine. But on behalf of that team, I will say thank you very much for all those people in the Ministry of Health who have done this. There are two other group of people in the government that we can need to say thank you to. The Ministry of Justice had bent backwards to get us signed all the legal requirements to get the vaccine in. The National Authorizing Authority, Mark you and her team, and they are not here today. I think they also bent backwards. They signed all the documents, they got us all the approvals as quickly as we can. Our colleagues from the Ministry of Finance closed their eyes to sign some of the indemnity forms, which most of us had to explain several times for us to get the vaccines here. So on behalf of all of us here, I would want to say thank you to those teams who are not here. There is a final group of people, Minister, Honorable, I hope you allow me to do it, is that the COVAX vaccines are not free. They are only free at the point of use. Somebody is putting money behind them. These donors have COVID in their own countries. They are battling with COVID. They still find it good in their hearts to donate millions, even billions of dollars to make sure people out here are receiving their vaccines free at the point of use. And I think we need to pay homage to them. I mean, because most of them are not here. Members of the EU are not here. The British High Commission people are not here. United States people are not here. And these are France. These are the guys who put Spain, Germany. These are the people who put the money up front for us. And we're going to have to benefit from that. And if you're going to, I will say this in a local language. I don't know whether any of you understand. Baraka. I don't know how to translate that in English. Yes, but in our local language, we say thank you. Thank you makes the heart cool, even though it doesn't remove the tiredness. So, it's one of us now. Anyway, so that's and first, lastly, I want to thank you, the media, for being with us here until midnight now to receive this. And please take it back for all of us, that Gambia has started receiving the vaccines. Gambia will start vaccinating. Gambia will start vaccinating its health workers first, and we'll roll it down to all the other susceptible people as quickly as we can. Thank you very much.
Thank you. Yeah, I need to say something. You know, it's very, very important to mention the efforts of people and to mention them by name, really, because certainly when people work hard, they need to be recognized. But the danger is sometimes you forget very important groups. And in as much as I finish talking, I cannot go without coming back to thank our public health officers. They have been doing very, very well, extremely, extremely well. They have been at the forefront of this response. So they have been a very crucial part of the team. And certainly without them, the team would be grossly incomplete and the team wouldn't win. That's why I said each and every member of the team is so, so important. But I thank everybody who has participated in the COVID-19 response. And all the other people who have held forth in other areas to allow others to participate in COVID-19 response, because other activities were also there, and their participation in those activities gave us the opportunity to participate. And the Director of Public Health himself is here.
Yes.
So that is the danger when you name some directors, and this man runs around between the airport and my office you see, he likes hiding at the back. But really, he's known a lot more for the quarantine. Yeah. But he does a lot more than that. Action man. Yes. You have to clap for him. Yes. Believe me, he's one of our strong men in this COVID response with his team, especially at the airport here, at the treatment centers, the quarantine centers, the border posts. It has been tough. This is where we've experienced a whole lot of challenges. Dr. Manjang, my sincere appreciation to your entire team.
Thank you.
Tell them the people of this country appreciate all their efforts, all the efforts that they have put in, the time, the resources, and all what they continue to do. The people of this country are touched by all your leadership and all your efforts. We appreciate it. Thank you so much.
Gambia has received 36,000 doses of COVID-19 vaccines through the efforts of UNICEF from the United Nations under a body called COVAX. Currently, we are at the Banjul International Airport, where the Ministry of Health, World Health Organization representative, and UNICEF representative are currently in presence to give us what the vaccine is all about. The people that are to receive these vaccines are those with high risk disease such as diabetes, hypertension, and healthcare workers. This vaccine is given to the Gambia from COVID. Gambia government did not spend even a single butut to bring this vaccine to the Gambia. It is through the efforts of UNICEF together in collaboration with the WHO. I Setukoli at the Banjul International Airport.
Supersonics money transfer wolle kudima na falia kabosain kata October karo bandula ha kabosain kata October karo bandula ibeganyo rokela mani botolal wato wati nitata kodota Gambia banko kanjak memboto na UK, Europe, USA, Canada wala fo Switzerland ni atambinin Supersonics money transfer ha barin diata kabosain kata October karo bandula wato wati nitata kodota Gambia banko kanjak memboto na UK, Europe, USA, Canada wala fo Switzerland alon ko ni mani boto be sela suwo konol nko mani boto keme dronne bijede wote bamban sain fo da kase ni mo kemol kono meni be gagné rokela ñun kudi mala kabo sai kata october karo bandula anin supersonics money transfer dorong ibe ñun soto la wol inyo sewondi ñun ku koyola mentariata alla no warta dum bata da clinteje kodita la karola katu yalo ne ko ñun len kodita dulatu men warta gambia banko be kanjang woto ni ko do taje wato wati hani fadino ita jola je tan na google play store wala na apple store bi ye supersonics money transfer app download ye ni sewondi anin ñun kodita dula anin supersonics ñun kudi ma be soto la woto dronne
You want to know about the Gambia entertainment industry. You want to know the existing policies and programs of the arts and culture sector. You want to know about the governance and management of the arts associations. The program will throw a fresh light on the entertainment industry in focus. We will touch so many angles about the cultural sector, the opportunities and challenges, and interrogate them, and most importantly, offer solutions.